The next bone to consider is the humerus. Okay, the humeral bone. So I'm going to isolate it. Now for the humeral bone is cylindrical in shape, and being a long bone, it is definitely going to have two ends. Okay, that's a shaft and two ends. The humerus is called the bone of the arm. That's two ends, the upper end or proximal and the lower end or distal. Proximal end, distal end. If you want to locate the orientation of the humerus, is this humerus the right or the left? If you want to position the humerus in the right anatomical orientation, you look at the position of the head of the humerus, if it is facing medially. And if we want to know if the humeral bone is anterior or posterior, the anterior part of the humerus will have these two tubercles. Okay, these two tubercles, you will notice it, an intertubercular sulcus. That is like a furrow or a gutter. Let's call it a furrow between these tubercles. Then another thing you'll notice is anteriorly, the humerus have this structure, okay, trochlea and the capitulum. But when we move to the posterior side, you will see that there is a fossa behind the humerus, and the name of this fossa is olecranon fossa, and that's why you know that this part is posterior, while the opposite side is anterior. Okay, so the proximal end of the humerus, this is the proximal end, this is the shaft, and this is the distal end. Now, the proximal end of the humerus have a head. Now, there's a neck right here. The humerus have a head. This is the head. There's a neck right here. There's another neck right here. And there are two tubercles. The proximal end of the humerus have a head that articulates with the glenoid cavity in the scapular bone. Okay, there's a cavity that allows for articulation of the head of the humerus in the scapular bone. It has a neck. Now, the neck at this point is called the anatomical neck. And then there's another neck, which is the surgical neck right here below it. So the depression immediately below the head of the humerus is the anatomical neck. And the next depression, after we've moved below the tubercles, is the surgical neck. This is the surgical neck. And this region is where the humerus can easily be fractured at the surgical neck. The reason why the humerus dislocates away from its bone is because the glenoid cavity does not completely cover the bone. So there's no complete covering over the head of the humerus. Therefore, it is easy to dislocate from its joint. So for the proximal end, notice the head of the humerus, the anatomical neck, the two tubercles. Now, this is lesser tubercle, and the one on the lateral end is the greater tubercle. Okay, this is the greater tubercle, this is the lesser tubercle. Now, there is a depression between them, and that is called intertubercular sulcus. Now, you see that when you trace it downward, it faints away, but the lower end of these two depression is like lips. This lip and this lip, they continue as this structure called supracondyle. Same as this, if you trace this other lip, if you trace this other lip, you see that it goes downward to become the supracondyle. So this part is the supracondyle of the humerus. Okay, so we are moving from the proximal end down to the shaft. There is a nerve that passes across the surgical neck, and the name of that nerve is. And if the humerus gets fractured around this region, it can affect the median nerve right here. And then the structures that are supplied by the nerve can be destroyed. Let's move to the posterior side. There is a very important structure right there. Okay, so here is the posterior aspect of the humerus, and here is the depression, which is the olecranon fossa. Now you will see that is a line that crosses behind the humerus. This line is called radial line or radial groove, and this groove admits the radial nerve. Okay, it admits the radial nerve, and the moment this bone gets fractured around this region, the radial nerve will be affected, and all the structures supplied by the radial nerve, all the muscles in the posterior side of the upper limb will be paralyzed. Here is the lower end of the humerus, and you see that the end is formed right from this point of the shaft. This is the shaft of the humerus, and if we trace it downward, you see that it continues as the supracondyle, and the supracondyle will end in this structure called epicondyle. That is the outermost condyle, epicondyle. this diagonal line along the side of the lower part of the humerus is called supracondyle. So if it's on the lateral side, it's called lateral supracondyle. If it's on the medial side, it's called the medial supracondyle. And also you notice that there's a difference in these two supracondyle. One is prominent than the other. The lateral supracondyle is less prominent than the medial supracondyle. Then the supracondyle ends as the epicondyle, same as this other side. It ends as the epicondyle. Now, there are two structures we should note at the inferiormost or distal end of the humerus. Okay, so, and that is this structure and this structure. Okay, so this is the epicondyle, this is the supracondyle. This is lateral supracondyle and medial supracondyle. Lateral epicondyle, and this is the medial epicondyle. Medial epicondyle is more prominent than the lateral epicondyle. You notice that there is this part and this part. Okay, so on the medial side of the distal part of the humerus, this side is called the trochlea. The trochlea. It is called trochlea. This part is called trochlea. Okay. Why this part looks like a head? So it is called capitulum. Because this part gives a head shape, and that's why it's called capitulum. And this is trochlea. All right. So let's move to the posterior side. So the posterior side of the humerus, you will notice the extension of the trochlea and the capitulum. Let's now talk about the fossas that are found within the distal part of the humerus. So these fossa are the one in the medial side, this little one, and this larger one. So this little one is called the coronoid fossa. And the coronoid fossa admits the coronoid process of the ulnar bone. The upper part of the ulnar bone has a C-shaped process. This side is called the olecranon process, while the lower side is called the coronoid process. So this process admits itself into this space when an individual flexes the elbow. The lateral side admits the radial head. Here, radial head. So the name of these two fossas are called coronoid fossa and radial fossa. Coronoid fossa is gotten or derived from the coronoid process of the ulnar, because that's where the coronoid process enters when you flex your elbow. The radial fossa admits the head of the radius, and that also admits the head of the radius when you flex your elbow. So that is the radial fossa. Okay. Now we'll move to the posterior side of the humerus. This large space is called the olecranon fossa. Olecranon fossa. So that means it admits the olecranon process of the ulnar bone. And just remember the progression of answering of anatomical question. It starts with the introduction. The humerus is the bone of the arm. Where is it located? It's located within the arm. Okay, that is after the shoulder, and they're all between the shoulder and the elbow. All right. Then you talk about the shape. It's a cylindrical shape. The right way to position the humerus. So you position it in such a way that the head of the humerus is facing medially. If it's the right humerus, it has to face medially. If it's the left, it has to face medially into the shoulder. All right. So that's for the head. And if you want to know if the humerus is anterior or posterior, the posterior aspect of the humerus have a large hole at the inferior end. And the name of that hole is olecranon fossa. The anterior side has two fossas or holes. Simply put, holes or fossa, but we use anatomical terms. Fossas. The anterior superior end of the humerus have two tubercles. Okay, so that's how you know that this is anterior, this is posterior. All right. So now let's move beyond that. Then we'll talk about the ends of the humerus. The humerus has two ends, the proximal end and the distal end. And in between the ends, there is a middle shaft. So the proximal end of the humerus has a head, and then there's a neck right here, which is anatomical neck. Then there are two tubercles, lesser tubercle and greater tubercle. The lesser tubercle is medial compared to the greater tubercle, which is lateral. Here's the first neck, which is anatomical neck. And this neck rarely gets fractured. There is a space or a depression between the two tubercles, and the name of that depression is intertubercular sulcus, and it extends downward into the shaft of the humerus, and that brings us to the shaft region. And this intertubercular sulcus has two lips, okay? This is the medial lips, that's towards the medial side. There is a lip that is towards the outer side, which is lateral lip. So this lip continues downward to form the supracondyle of the humerus. The supracondyle, it's in different location. So on this side, you have the medial supracondyle, and on this side, you have the lateral supracondyle. And if you want to describe the shaft of the humerus, you say the shaft of the humerus is cylindrical in shape. As a way of introduction, the humerus is the longest bone in the upper limb. This fossa is called the coronoid fossa, and the coronoid fossa admits the coronoid process of the ulnar bone. Okay, and it admits it when the elbow is flexed. Let's move to the lateral side. So the fossa on the lateral side is called the radial fossa, and that admits the radial head or the head of the radius when the arm is completely flexed. This structure at the lower end of the humerus is called the trochlea, while this end is called the capitulum. Capitulum. Okay, trochlea and then capitulum. Trochlea, capitulum. All right. So let's wipe it off again. Clear all the drawings. Now let's consider the posterior aspect of the humerus. So for the posterior aspect of the humerus, you will see that there is a depression in the bone, and it goes diagonally as well, just like the intertubercular sulcus. But this time, it is a depression that moves to the lateral end of the humerus. Let me annotate it. And here is the depression, and it goes downward to the lateral side of the humerus. Okay. Remember, this is the lateral side, this is the medial side. Now, this depression admits an important vasculature or neurovasculature, and the name of that neurovasculature is the radial nerve. The radial nerve. Okay, so it admits the radial nerve. This depression admits the radial nerve. So if this part of the bone is fractured, then the radial nerve will be affected, and all the posterior aspect of the upper limb will be paralyzed. For the depression in the distal end right here, okay, this depression is olecranon fossa. This is the, you see, this is a trochlea. This continuation of the trochlear bone at the lower end of the humerus. And look at the epicondyle. This epicondyle is more prominent than this epicondyle. So this is lateral epicondyle, and this is the medial epicondyle, right? So this lateral, this is medial. Now, there's one more thing you should know about the medial epicondyle. There's a nerve that runs through the medial epicondyle right here. Let me annotate it. The nerve goes downward. The name of this nerve is the ulnar nerve. Ulnar nerve. So when you rest your elbow on a hard surface for a long time, or you applied much pressure, or you suddenly hit your elbow from the medial end on a hard surface, you feel an electrifying feeling. Okay, so that feeling is called funny bone, and it's because of a compression in the ulnar nerve. And if you rest this elbow for a very long time, you will lose sensation to these two fingers. Right? So you lose your sensation to these two fingers on the medial side of the hand. Sensation to the medial side of the hand and the two fingers. So that is the role of the ulnar nerves. And then in an elbow injury, if someone falls from a very great height and lands on his or her elbow, the epicondyle can get chipped off, and through this fracture, the ulnar nerve can be injured.